Dr. Moore's Diaries, Whispers from the Morgue. Episode 1. The Dawn of Autopsy. The first documented autopsy takes us back to ancient Egypt around 3000 BCE, though not in the form we might recognize today. The Egyptians performed a specialized form of post-mortem examination during their mummification processes. However, their purpose wasn't scientific or medical inquiry. It was spiritual preparation for the afterlife. The first true forensic autopsy with medical documentation appears in history around 44 BCE, following the assassination of Julius Caesar. The physician Antistius examined Caesar's body and noted that among his 23 stab wounds, only one was actually fatal, a wound that penetrated his chest between his ribs. This examination represents one of the earliest recorded instances of a death investigation for determining precise cause of death. The scientific autopsy, as we understand it today, began in Alexandria during the 3rd century BCE. Greek physicians Herophilus and Erasistratus conducted the first systematic human dissections, challenging Aristotle's earlier anatomical theories. Their work was revolutionary and controversial. They were accused of performing vivisections on condemned criminals provided by the Ptolemaic kings, though historians debate the truth of these allegations. The Renaissance saw the true birth of modern autopsy practices. In 1302, Italian physician Bartolomeo da Varignana performed a documented autopsy to determine if a victim had been poisoned, one of the earliest examples of forensic pathology. By the 16th century, Andreas Vesalius revolutionized the field with his groundbreaking anatomical work, De Humani Corporis Fabrica, 1543, based on numerous autopsy dissections. The driving forces behind these early autopsies varied: legal justice, determining cause of death in suspicious circumstances; medical education, understanding human anatomy; scientific inquiry, challenging existing theories about the human body; public health, identifying causes of disease outbreaks. Perhaps most fascinating is that what began as a controversial and often secretive practice eventually became a cornerstone of modern medicine, law enforcement, and our understanding of human mortality. Each cut, each examination represented humanity's growing desire to understand not just how we live, but how and why we die. Next episode, the anatomical theaters, when autopsy became public spectacle. Like, subscribe, and stay tuned for our next video coming soon.